Welcome back to the channel. If this is your first time here, my name is Marshall. I'm a licensed massage therapist, a personal trainer, corrective exercise specialist, nutritionist, the list goes on. And this channel will cover all of those types of things over time, working on putting together a bunch of different playlists so that you can find the videos that you're interested in. But today we are here to talk about foam rollers and why you might be using it wrong and how it can better suit you. So stay tuned, make sure to like, subscribe, and share. Okay, so the first thing we need to understand is why there are different types of foam rollers, why there's all the different colors, different textures, different shapes. They do have a purpose. So here I have a white and a black foam roller, and these are your basic foam rollers that you should be able to find everywhere, whether it's Walmart, Target, Amazon, doesn't matter. These are your standard entry-level foam rollers. So the white roller here is the least dense. If I stick my thumb into that foam, I can poke it in pretty hard and it will rebound nicely, but that's going to be a softer foam roller for working in shallower tissues. So if you have a lot of adhesion or you have a lot of inflammation, that's going to be a more forgiving roller than all these other ones here. Now, if you've worked with a white foam roller for a while and you're not finding a lot of discomfort or adhesion or muscle tension, then as that one becomes less effective, we would graduate up to the black roller. Now, if you're already thinking, every time I roll up and down that roller, it hurts. Let's just take a moment there to explain that the type of foam rolling I'm talking about is not actually rolling. We're not getting on the roller and rolling up and down like you see everybody do all over YouTube and TikTok and whatnot, okay? So what we want to do is we want to use these rollers to find knots and adhesions, discomfort in the soft tissue, and rather than rolling over it back and forth, we're going to hold, and we're looking for discomfort in the range of about a 4 to 6 on a 1 to 10 scale. So it's discomfort, but it's not excruciating pain. If it's excruciating pain on a black roller, you need to go to a white roller. Okay, if it's excruciating pain on a white roller, then we need to modify how you're using the roller. Maybe stand up, lean into a wall, wrap a towel around it to make it softer, something like that. And what we're doing is we're finding these areas of discomfort where fascial adhesion and inflammation exist, and we're going to hold pressure in that 4 to 6 range, and we're going to breathe, and ultimately we want that 4 or that 6 to go down, 6 to a 4, 4 to maybe a 2. Any decrease is improvement, any improvement is progress, and if we have an area that's very inflamed, especially if it has been for any length of time, or it was agitated by overuse, such as an endurance event, and now it's crampy and it doesn't want to calm down. First off, make sure you hit that with some cold submersion therapy. That'll help with the overall inflammation. Then we're going to hit that roller and use some hot submersion therapy, ideally. But that one spot may not go away and it may not reduce if that whole muscle is inflamed. And you got to think of that like knots in a rope. If you've tied 10 knots in one rope, the original knot's the tightest one. It's going to be the hardest one to get out. But if you start by getting out the knots that are easier to release first, take tension off the rope as a whole, eventually you'll be able to undo that oldest and tightest knot. And we can kind of apply that to working that soft tissue as well. So we start with the white roller. We're holding, we're breathing, we're releasing. And over a few weeks, we find that we no longer find any spots to release with the white roller. So then we move on to the black roller. Now we're getting into a slightly deeper layer of that soft tissue, and we start that process again. We've graduated to the next level. We do the same thing with the black roller. Then the black roller starts becoming less effective. We're not finding a lot of stuff. We go to something like the trigger point roller. The Trigger Point brand is very popular. You should be able to find that just about everywhere. And I would say it's about a half step up from the black one. And Trigger Point does make also a firm version of it that would be a full step up from the black one. This is the half step. And you'll see that now we're getting into some textures on the roller, and that's to allow for as we're using deeper pressure and we're pushing in that tissue, we need to allow for backflow of fluids. Allow the blood and the interstitial fluids to backflow through these grooves. At this level, you're not really using that texture to get deeper, you're just allowing that backflow of fluids. When we get to something like a rumble roller, now this is kind of the end all be all. If you've gotten to the rumble roller, you're probably at the athletic level, you don't have any necessarily pain or dysfunction, and you're trying to do deeper treatments in the muscle tissue as you train for whatever your event may be. It still warrants that type of hold and release therapy, even at that level, to maintain proper function in the muscles. Now, the difference between what I'm talking about and these videos that I mentioned earlier, where you're actively rolling on the tissue, is that rolling method is designed to change the viscosity of the tissue prior to exercise or an athletic event, so that that tissue is essentially warmed up, the viscosity has changed, the fluids are moving better, they're warm, and you're ultimately making it so that the tissue can reach maximum extensibility within its current available range, allowing the joint to move better. And the goal there with that type of active rolling is that we're trying to prevent muscle strains, muscle sprains, and joint injuries during the workout or during the competition that you've prepared for. Whereas when we're doing the holds and we're working on releasing knots and adhesions, that can be done lightly, like a couple spots along with your dynamic rolling before an event to improve that tissue extensibility. But generally, when I'm doing this with my patients, we're spending 20 to 40 minutes doing that and following that up with static stretching to not just increase viscosity performance in the tissue, but also to actually take the extensibility to an increased range of motion at the joint. So we're talking about muscles that have shortened, muscles that are so tight that we're not reaching proper range of motion. Extensibility is limited within that tissue, and we're releasing knots and adhesion, and that's why we're spending more time doing these holds, followed by static stretching to essentially take tissue that has had knots broken up, had adhesions released, and pull on that tissue in a controlled fashion to increase the range of motion at the joint, not just reach the maximum already achieved extensibility. And so now we're changing tension at the joint. So you might have one side of a joint's tight, the other side is being pulled on. So one side's short tight, the other side is tight because it's been lengthened and pulled on. So that's the side that tends to be agitated. The shorter side might be crampy or just limited in range of motion. And by releasing that tight side, we take some tension off of the side that's being pulled on. We allow the joint to slightly return to a more neutral position, which is going to help it function better, reduce pain and inflammation in that joint. And so we do the static rolling first, or static release using a foam roller. Then we do the static stretching to essentially pull on that tissue. It's similar if you're a gardener and you get two plants whose roots grew together. We don't just cut the roots apart to save the plant, because if we leave them sitting there, they'll grow together again. We cut the root ball apart, we separate the plants. We release the fascia and the nerve endings, and then we move the tissue so it doesn't just rebind, right? Same thing. And then that does create inflammation of a different kind from the inflammation that was already there. And so then we want to make sure we're using that contrast hydrotherapy. I'll do a video on that soon, where we're doing cold immersion therapy, cold soaking, or at least ice packing, followed by moist heat pack, or like hot tub, hot soaking. And I'll go into why we do that, timing, temperatures, all that kind of stuff in that video. But for now, I just want you to understand the different levels of the foam roller, why they exist, why we're holding rather than actively rolling and when active rolling is appropriate versus the holding. And then here in a minute, we're going to switch over to a second part of this video where I'm going to actually have some of the more common foam rolling positions demonstrated by Jess, and I'll introduce her here in a second. I'm training her for triathlon. She actually has her first one in 2 days. So maybe we'll get some footage of that and talk about like how her training has been going. This will be her first triathlon. It's a mini, it's not quite even a sprint, but her ultimate goal is to train for Ironman. So she's going to rely on these quite a bit, but these are great for helping with acute injury recovery. They are essential for repetitive stress injury recovery. And a lot of repetitive stress injuries, I'm just going to say it while we're here, things like carpal tunnel, plantar fasciitis, thoracic outlet syndrome, these are all things that can easily be fixed in a short amount of time if they're addressed appropriately. And different therapists and doctors want to use whatever tool they have. The surgeon wants to offer you a surgery, and the PT is going to offer you exercises, and so on and so forth. The MD is going to offer you anti-inflammatory drugs and painkillers and things like that. Everybody wants to give you what they have to contribute to your condition, and a lot of those things can be useful. None of those things are going to fix it by itself. And I'm not slamming any of those therapies or doctors. I'm just, my point here is, with repetitive stress injuries, there's always going to be a tight side of the joint and an inflamed or destabilized side of the joint. And ultimately, the best approach is going to be releasing the tight muscles through adequate amounts of release work, whether that is time on the table with a medical massage therapist, which is what I do mostly these days, time spent foam rolling and stretching with the right techniques, and then adding exercise on the opposite side of the joint to strengthen the muscles that have been pulled on and or were destabilized. And that's where the PT comes in. And then along this process, in conjunction with, say, contrast hydrotherapy, we can add in what the MD is offering you, which is anti-inflammatories and pain meds. But they're not the solution themselves. The exercises are not the solutions by themselves. It's the combination of all the right components used in the right sequence. And so when I say sequence, I mean if you start with exercise in a repetitive stress injury scenario, it's very rare that you're going to get the result needed. Sometimes it happens because you just have one muscle that's not strong enough, that's destabilizing a joint, and exercise is all you need. But for the majority of people, you're going to need release work first, because you can kind of think of it as a tug of war. You've got a joint that's meant to be, centered somewhere, and it's being pulled to one side. And if we simply try to add strength on the side that's being pulled on, it's already inflamed, it's going to inflame more. And that's going to make it a very long path if that's the only solution being used. We need to release the side that's pulling first and allow the other side to become more neutral. Then we can strengthen that when some of that inflammation is gone, and that muscle tissue will respond much better and much quicker, right? So the release has to come before the strength. And both of those things are needed to reach a permanent fix versus, just taking anti-inflammatories and pain meds and hoping it goes away on its own. If it was a minor strain that was doing something you don't normally do and it's just a little bit sore, sometimes the meds will get you through the weekend and your body will recover and you'll be okay. Doesn't mean it won't come up later down the line because you kind of set something up that might develop into a compensatory pattern and then re-injure later. So I'd still look into that. I'm big on healthcare, meaning preventative care over reactive care, right? And that's the other thing is most of the people I see, they're coming in, it's reactive. They've already been injured. They've already allowed a repetitive stress injury to reach a point where now we have to have all these components and they have to be in the right order in order to get that result that we're looking for. And I like to encourage people to have an assessment done, not because you're injured, but because you don't want to get injured, especially if you're an athlete. But even just, everyday people, if you've already got tight back in the morning, or you tend to not feel like doing a lot because you just feel like you're not as young anymore, you're not as flexible anymore, whatever. If you're feeling like that, there's issues in your body that may not be considered an injury yet, but that's a setup for an injury. And we don't want to feel like that anyways. Let's fix that first so that we A, don't get injured, and B, don't feel that way and we can be more active. So a little bit of a tangent, but I feel that it's important to consider when we're talking about things like foam rolling. This should be an active part of everybody's daily health routine, quite frankly. And once you understand more about foam rolling, and it's not just something you see athletes doing at an event where they're rolling up and down that roller and you tried it and it hurts. That's not what rolling needs to be for most people. And so we'll get deeper into this later. Right now, we're going to transition over to a different part of this video where we're going to start to talk about how to address different issues using different foam rolling techniques for different body areas. So this is going to be kind of a long video. If you're not interested in that part, thanks for stopping by. If you do want to learn how to do certain body areas, I'm new to this. I don't know quite how to set it up so you can jump around, but stay tuned and use the slider as needed. And we're going to do some calves, some quads, some glute work, some shoulder work. We'll keep it fairly simple, maybe 5 or 6 different body areas. So hang tight. Be sure to share this with your friends. If you haven't already done it, like, subscribe, and let's go over and meet Jess, and she's going to demonstrate some of these things as I talk you through them. All right, so this is Jess. This is the person I was talking about earlier that's currently training for triathlon, and she's also studying to be a yoga instructor and is a massage therapy student and a personal trainer. You have a certification in nutrition as well, right?
Yes, I do.
So I'll also put her contact information in the description of this video. And in the meantime, I'm going to use her as a body to demonstrate some of the foam rolling positions and release techniques that I was describing earlier that are more commonly used. And then I'll eventually make a video where we go into more advanced release techniques and additional tools to do releases as well. So we're going to start out today with probably about 5 or 6 of the more common ones, and so stay tuned. Here we go. Okay, so our first demonstration, let's do calves. So we're going to demonstrate one calf at a time. Generally you want to start distal and work towards the heart. If there's swelling to be removed from an area, this is important that we push the swelling towards the center line of the body so it can be processed out and not down into an appendage where it can get stuck. So as you can see, Jess is crossing her free leg over the one that she's working on to add pressure. Now, if you were a beginner, you might start with just the white roller and possibly just the one foot by itself. Jess is kind of an intermediate, so she's using a slightly textured travel roller that folds down flat, and she's adding extra pressure by putting the other foot over that roller. Now, if you're a beginner that lacks flexibility, you can always put yourself up against a wall so that you're not having to hold yourself up, causing your shoulders and upper body to be tired. So after holding for maybe 30 seconds or so on a spot that I assume she found right away, you can turn your foot in or out slightly, because this is a very large muscle area, and so being directly straight up and down, you're kind of hitting the middle of the calf, and by pivoting in and out you can hit the lateral and medial sections. And then here you see that she's simply unweighted the left foot and pulled the roller a little bit towards herself with the right foot, to find and check the next area. And you can do this all the way from the Achilles tendon to the top of the calf or almost behind the knee. You can also, if you prefer, just lift your butt off the floor and slide a little bit down to make that adjustment. However, for some of you that might be too much pressure and might be unbearable, so it's not necessary. You can lift it and roll it up with the other foot. So this is how we would start doing the calves. And this one is paramount for our runners, our triathletes, our cyclists, anybody that's going to be using lower body, and or anybody who has any type of tension in their calves, regardless of whether it's a repetitive stress injury or just swelling because you stand all day at work and you need to relieve tension in that area, push the swelling out. If you are dealing with swelling, make sure that you follow up with the contrast hydrotherapy. So let's go ahead and move on here to glutes. Okay, now you'll notice that
Sorry, that hurts.
it's an area that tends to be a little tender, especially if you've been training in cycling and other things like Jess has. So notice that she is tipped up onto specifically her left glute. She's unweighted the right side so that she's using a good angle and extra pressure here to focus just on the one side. Now, if it was too much pressure, again, our first step is to regress maybe to a black roller or a white roller. But if it's manageable, which it is in this case, we stay here and maybe just kind of flatten out a little bit, or use a yoga block under the hand to take some of the pressure off. You're going to work from wherever you start. Ideally, we're clearing, and as I discussed in the very beginning of the video, this is kind of a search and destroy mission. We're looking for trigger points and adhesions and areas of discomfort, and we want to get several of those out of there. So she kind of jumped in mid glute, so she'll work her way up the back of the glute to the hip bone, which is called the PSIS, and then back down towards the bottom of the glute and notice she dropped down to her elbow here for comfort because her shoulder doesn't need to suffer for this. Also, if your shoulders are sensitive, you can put a yoga block under the arm that's on the ground, which will take some of the weight off of that shoulder. So from the PSIS, or the top of the posterior part of the glute and hip there, she'll work her way down to where the glute and the back of her leg come together at the top of what many people perceive to be the top of the hamstring, although the hamstring actually goes all the way up under that glute. We'll discuss that later in a different video. So generally, I don't recommend trying to foam roll your hamstrings. Most of us have very broad, flat hamstrings, and we're not going to get them very well with a roller. So in a different video, I'll cover better ways to release that area. But she would do the glute, and she's going to probably very reluctantly, with a whole lot of grunting and face stuff here, demonstrate how to transition from the glute to working the tensor fascia lata and lateral quadricep muscles, the vastus lateralis. So here you can see she's rolled onto her side with what's called the tensor fascia lata, right up in the hip there, being on that roller. This helps to loosen tension on the IT band and ultimately loosen the lateral portion of the knee, as well as help the hip itself. But a lot of people, you'll see people running with a band right above their knee because they're experiencing some sort of knee pain. It's usually a lateral pulling or lateral dominance or tightness in that IT band. And this tensor fascia lata muscle is what tensions the IT band, in addition to there being the potential for fascial adhesion connecting that IT band to other structures like the vastus lateralis. So that's why we're going to roll the vastus lateralis by working our way from the TFL down the side of the leg. One thing we don't want to do, as you can see, she's a little short on space because of the beanbag here, but if she had more space, she'd keep slowly working her way up, or moving the roller down so she could use a free hand to just kind of scoot that down. And the only thing we don't want to do here is we don't want to put that roller directly on the side of the knee. That would be bad. We don't want to torque that knee over, but you can get fairly close to it. When you get down to the head of the vastus lateralis, that does tend to be a very hypertensive area and can be rather uncomfortable. So again, you can go down in density of roller. If you need to, you don't have another roller, you can always stand up and lean it into the wall for less pressure. And as I mentioned before, think of this in terms of a rope full of knots. We're not going to get every knot out in one shot, but if we get a few out right now, we get improvement, reduction in tension, and eventually the tighter knots will loosen up over time and they'll come out as well. So the last one we're going to go over for lower body today is the quads. So what she's going to do here is she's going to go prone or lay face down and place her quad or quads on the roller. Notice that she started with her knees on the roller and extended her legs out. That's usually, in my opinion, the easiest way to get on the roller. We want to roll from just above the patella or kneecap to as high as you can go. And sometimes for women that might be a little higher than the men. You can also do this one leg at a time to get extra pressure, or just focus on one leg. And similar to the calves, you can turn your feet pigeon-toed towards each other or away from each other to get lateral and medial aspects of the quadriceps group, because there are multiple muscles in there. From you got your vastus lateralis, you got your rectus femoris. There's more than one muscle. There's going to be a vast area to clear. So generally speaking, each of these muscle groups, I wouldn't spend more than a minute on any one trigger point or adhesion. If it's not getting better, move on after about 60 seconds unless you feel like you're on the verge of releasing it. And in a given area, like the calves or the quads or what have you, I wouldn't spend more than about 3 to 5 minutes, because you don't want to bruise yourself up and not be able to roll tomorrow or the next day. In this case, we're not going for massive change right now and then recuperating for 4 days like you do on a massage table. We're going for some small change compounded every day over time. Okay, so that'll be our last spot here to demo lower body. And now we're going to demonstrate just a couple for the shoulders and back. But before we do that, I want to point out that at no point ever should the foam roller be directly on the bottom 3 ribs. The bottom 3 ribs are floaters, and they can dislocate or crack. So we never want to be directly on our side on those bottom 3 ribs. So let's go ahead and start with being on the side. We're going to start right up in the armpit. Sometimes people will feel this one all the way up into the tricep. Sometimes it'll feel more like it's subscap or teres, depending on where you're positioned exactly. All of these muscles need to be relaxed and not hypertensive. And the pec minor, being more towards the front, is a real key player here, because the pec minor is one of the muscles, along with your subscap and your teres, that can front load that joint and cause dysfunction in the shoulder joint or pinching with certain movements. And so again, similar to changing the foot position for the calves and the quads, we can change whether we're hitting more pec minor or more of the teres and subscap, or even lean back and get into the posterior side of the shoulder a little bit. And we're going to work from about the 4th rib up all the way up into almost the back of the arm. So there is still a little bit of a range here that we're working for this one. And the rules are the same. Again, stay off the bottom 3 ribs. Spend about up to a minute on any knot. If you're on a knot or an adhesion and you are focusing on your breathing and you feel it dissipate or improve significantly, you don't need to wait the whole minute. We're just looking for either the improvement, what I refer to as tissue change, or a minute kind of maximum, and then move on. So you would roll here up and down the rib cage, staying off the bottom 3. I'm going to have Jess transition into a pec specific release. So let's move that roller to the right side so that it's seen by the camera and also not crushing the microphone. Okay, and we're going to change the angle on this a little bit here. We're going to angle up at the center. There we go. And that's going to fit that triangular shape of the pec much better. And we go ahead and reach out that direction here, kind of kitty corner. And we're literally reaching towards the fingers and leaning our weight into the roller here. And that's how we're going to get that pressure on that pectoralis muscle group. And we've got kind of pec major and pec minor near the insertion for this one. There's not a lot of room to adjust here, but she can kind of push herself a little bit further up onto that roller. Over the years, I have gotten a few women that say, well, what happens if I, squish my breast tissue? Well, it'll move because you're keeping consistent pressure here and the roller's moving towards you, so it's just going to push that tissue more towards your center line out of the way. So generally here I shoot for about 2 or 3 adjustments of about 1 inch per, starting all the way out pretty much in the armpit and working 2 to 3 inches further in onto the pectorals. And then that's about it for this one. And like I said, I'll teach some more advanced stuff later. You can see Jess wiggling her hand, feeling a little numb over there.
Yep, just a little bit.
So what she's experiencing here is we're pressing into the pec minor. It's probably pulling on the shoulder on the acromion process, which might be kind of crowding out that brachial nerve, causing a little bit of tingling sensation. That's normal. As soon as she gets off that roller, it's going to go away, and that's perfectly fine because by releasing some of the tension on that pec minor, the joint, the AC joint, won't be as tight and it'll be less likely to pinch and give her that sensation when, reaching overhead or reaching out in front of her. So it's a little bit of discomfort for progression towards a healthier shoulder. All right, so for our last one for today, let's go ahead and do the upper back. And so for this one, the biggest thing is I don't like to see people throw themselves over the roller. Like a lot of times people will just go dive bomb over the roller to get in position. It's better if you just kind of sit in front of the roller. So Jess is going to pin up her hair here. If you are in a hoodie or you have long hair, you want to make sure that it's out of the way, because if you roll onto it, you kind of not only jerk your head back, but you get yourself stuck. So she's going to move a little bit more towards the movie cabinet here so she has room to go up. Notice how she's easily leaned back on it. And what she's going to do is just start off with an initial assessment of the tissue. We want to make sure that we're relaxing the neck. You don't want to get the anterior part of your neck tight. So you can just let your head hang back, or you can do what she's doing, which I call hammocking, basically allowing her head to rest in her hands. And she's going to roll from about mid-back, not quite in the lumbar curve. We want to stay away from the apex of the lumbar curve, slightly above that, all the way to the top of the shoulders. And if she wanted to target some type of trigger point or adhesion that she felt like was more to the left or right of the back, she could simply drop her knees in that direction. So she's dropping her knees to the left. She'll have more pressure on the left side of the roller or on the left side of her posterior area here, whether that's the shoulder or the back. So then she can go to the right and put more tension, more pressure on the right side. She's going to work all the way from where she started, just above mid-back, to the top of the shoulders and back down to where she started. Again, this should take 3 to 5 minutes, at which time we're going to make one adjustment and repeat the process. So we're not going to go ahead and demo the whole thing. We're going to go back to where we started. And what she's going to do is she's going to release that hammock and she's going to give herself a big self-hug. And by doing that, she has pulled her scapulae away from the midline, actually exposing more muscle tissue or new muscle tissue that wasn't available to the roller the first time she did it. Now in the video here, you can see what appears to be her hair getting very close to the roller. There we go. So that's where we want to be careful, because once you roll onto it and kind of suck your head back, you're kind of stuck. It gets really awkward. So watch the hoodies, watch the ponytails. And again, another 3 to 5 minutes working your way up. This area generally is muscles that are protected behind the scapula, and so they don't get a lot of exposure, and they're going to be probably more sensitive than the muscles you rolled while your hands were hammocking your head. So, I did mention earlier in this video, and I always encourage my patients and my students and everybody that I work with, and all my athletes, once you foam roll, doing this type of foam rolling, where we are searching out adhesions and trigger points and spending time releasing them rather than dynamic rolling, that is the most opportune time to stretch the muscles that you've rolled. Get that tissue that you've just released moving so that it doesn't just start rebinding. And if possible, the ideal scenario would be to follow that up with contrast hydrotherapy. And we'll discuss more of that in another video.
Don't be alarmed if your back starts popping when you're doing this.
Yeah, cavitation is normal. Most people say it feels good when it happens. The goal is not to cavitate on purpose, but it does happen when muscles that are holding things out of alignment or fixating vertebra loosen up, things can move, and that can be very healthy. So your weight is spread evenly across the roller, so generally it's not going to push anything, into being out of alignment. It's just going to loosen things up and help it be more in alignment. So, any other tips that you've heard me say that I didn't cover here? Hydrate well.
Oh, yes.
Definitely hydrate well. You don't want to do all this and be dehydrated, because that can leave you a little bit crampy or a little bit sore for several days. If you're better hydrated, you won't have as much issue with this.
If I don't hydrate well, I actually feel very sick.
And some people do experience that as well, so make sure you're well hydrated. But yeah, that's going to conclude our, what was that, about 5 or so?
Yeah.
I didn't really count them. Main kind of beginner foam rolling areas and techniques. And we'll follow this up with more advanced rolling, pinning, and stretching using additional tools in another video. So hopefully this helps a few people understand foam rolling in a different light than the dynamic rolling that people see on YouTube, and gives you some idea of how to kind of get started with this type of approach. So I've said it, I think, twice now. I'll say it again. Please like, subscribe, share this, and help me get the viewership to where I can make my money teaching and afford some better camera gear so that I can bring you better videos and make this my full-time job and help other people, do treatments and such for free, because I'm making the money off of the videos and not off of being a full-time therapist. So, see you in the next video. Namaste.